Myself, myself Dr. Rajendra Sharma, Associate Professor and Mahatma Gandhi Nursing College. Today I have discussed about the catheterization.
Catheterization of the urinary bladder is the insertion of hollow tube through the urethra into the bladder of removing urine. It is an aseptic procedure for which sterile equipment is required. Next, we have to discuss about the purposes of urinary catheterization. So, firstly, we have to relieve the urinary retention, and after then obtain sterile urine specimen for a female patient. And next is measure residual urine. Then empty the bladder before, during, and after surgery. Next, we have allow the accurate measurement of urine output. Next, we have to discuss about the urinary catheter sizes. So we are related to the catheter size of the depending on the patient. So we have to discuss about the size of the catheter. So we have to check the catheter into French scale. So we have to each unit is regularly roughly equivalent to 0.33 millimeter in diameter. Okay, we have to indicate a diameter in the 18 French per per of 6 mm. The smaller of number, the smaller is catheter related to the patient. Okay. A larger size catheter used for a male because it is stiffer. Thus easier to push the distance of the male urethra. Catheter come in several sizes. Now, first one, number 8 French to 10 French are the used for the children, and number 15, 14 to 16 are used for the female adult. Number 20 French to 22 French are usually used in male adult. Type of urinary catheter. Intermittent catheter. Intermittent catheter is used to drain the bladder for the short period, 5 to 10 minutes. It may be inserted by the patient. This is the size. First, you have to see this is the balloon size, or this is size French related to the urinary drainage port, and second one is the balloon port. You have to insert the sterile water. Retention or indwelling catheter also, this type catheter is placed into bladder, secured there for the period of time. Next, third one, suprapubic catheter. This type of catheter is inserted into the bladder through a small incision above the pubic area. It is used for continuous drainage. Next, we have to preparing for the catheterization. Before doing the procedure, we have to what are the kind of the equipment we have to used in the catheterization procedure. A catheterization should be used only when absolutely necessarily, and the catheterization procedure itself should be done only by trained personnel under sterile condition. Infection is a major risk of urinary catheterization. So these equipment are the necessary for the procedure of the catheterization. First one, we have to collect the catheter according to the patient size, or the second one is the 10 ml of syringe. Then we have to collect the sterile water, cotton ball, and with betadines, lubricants, sterile gloves, flashlight or lamps for the perfect like that the perfect position of the patient. Then urine collection bag, velcro leg strap or inchoate tapes, and disposable bags. First, we have to going to done this procedure. Explain the procedure to the patient. Next, provide the privacy and educate lighting and positioning also. We have to supine position, we have to take the position for the patient for the urinary catheterization. Position the female patient in dorsal recumbent position with the knees flexed and the feet about 2 feet apart. Cover the upper body and each leg. Place the catheter set between the female patient and up's leg. Second one is the position a male patient is a supine position. Drape the patient so that only the area around the penis is exposed properly. Place the catheter set next to the leg of the male patient. And then we have to inserting the Follis catheter in a male patient. Cleanse the genital area properly and perineal area also with wrap soap and water, rinse and dry. Then second one is wash your hand carefully before going to procedure. Then open the sterile catheterization kit using sterile technique. Next one is the put on the sterile gloves. Next one is open the sterile drapes and place on the patient abs, thighs. Place fenestrated drape with the opening on the penis. Next one, apply sterile lubricant liberally to the catheter tip. Lubricate at least 6 inches of the catheter. Leave the lubricated catheter on their sterile field. Then we have to pour the antiseptic solution, 2% xylocaine jelly, over the cotton ball. Next, place the urine specimen collection container within easy reach, because the sterile procedure, before going to sterile procedure, we have to take the any type of specimen or sample. Next, grasp the patient abs penis between your thumb and forefinger of the non-dominant hand. Retract the foreskin of an uncircumcised male. The gloves hand that touched the patient is now contaminated. Use the forceps to hold the cotton ball. This will maintain the sterility of one hand. Using the forceps, pick up one cotton ball and swab and the center of the meatus upward in a circular manner. For the cleansing is the properly maintained according to the this procedure. Next one, the continue outward using a new cotton ball for each progressively larger circle. Clean the entire gland. Deposit each cotton ball in the disposable bag. After last cotton ball is used, drop the forceps into the disposable bag as well as. Hold the penis at a 90-degree angle. Advance the catheter into the patient abs urinary meatus. You may encounter resistance at a posterior sphincter. You have also this picture. We have to show this picture. Pause allow the sphincter to relax. Next one, lower the penis and continue to advance the catheter. Note, we have to inserting the catheter. We have to never force the catheter to advance. Discontinue the procedure if catheter will not advance or the patient has unusual discomfort. Get assistance from the charge nurse or physician. Next one, when the catheter has passed through the prostatic sphincter into the bladder, urine will start to flow. Gently insert until 1 to 2 inches beyond where urine is noted. Next, to inflate balloon using correct amount of sterile liquid, usually 10 ml, but check actual balloon size according to patient. Gently pull catheter until inflation balloon is snug against bladder neck. Next, connect catheter to drainage bag or drainage urine catheter. Anchor the catheter tubing to the lateral abdomen with prep without tension on tubing. Place drainage bag below level of bladder. Next, evaluate catheter function and amount, color, odor, and quality of the urine. Remove gloves, dispose of equipment appropriately, wash hand, and document size of the catheter inserted, amount of water in balloon, patient F's in response to procedure, and assessment of urine. You see this picture and uh, how can to snug the catheter. Inserting the Polish catheter in a female patient. Follow procedure same as the male step as usual to 1 to H same age, but some are the different procedure according to the female. First one, place the thumb and forefinger of your non-dominant hand between the labia minora. Spread and separate upward. The gloved hand that has touched the patient is now contaminated. Next point, just using the forceps, pick up a cotton ball saturated with antiseptic solution. Use one cotton ball for each stroke. Swab from above the meatus downward towards the rectum. Next, we have to next step, keeping the labia separated, cleanse each side of the meatus in the same downward manner. Do not go back over any progressively cleansed area. Next step, we have to deposit each cotton ball into the disposable bag. After the last cotton ball is used, deposit the forceps into the bag as well as. Next, continue to hold the levium apart after cleansing. Insert the lubricated catheter into the female patient F's urinary meatus. Angle the catheter upward as it is advanced. If the catheter will not advance, instruct the patient to inhale and exhale slowly. This may relax the sphincter muscles. Do not force the catheter because some time of complications are inserted time. Next, when urine start to flow, insert the catheter approximately 1 inch further. Place the cup under the stream of flowing urine to obtain a sterile specimen if you require. Next, inflate balloon using correct amount of sterile liquid, usually 10 ml, but check actual balloon size as usual, as male or female are the same process. Next, gently pull catheter until inflation balloon is snug against bladder neck. Next, connect catheter to the drainage system. Connect the drainage bag to the catheter. Secure the catheter to the inner aspect of the female patient and abs and thigh. Male patient also different place and female patient also place are the different. Place drainage bag below level of bladder. Evaluate catheter function and amount, color, odor, and quality of the urine. Remove gloves. Dispose of equipment appropriately. Wash hand. Document size of catheter. You have to insert it and amount of water in balloon. Patient and abs response to the procedure and assessment of urine. After maintaining an indwelling catheter, next step we have to consulting about the indwelling catheter. Wash your hand before and after caring for the patient and wear gloves when handling an indwelling catheter. Clean the perineal area with soap and water twice daily and after each bowel movement, especially around the meatus. Use a separate area of the cloth for each stroke. Next, avoid use to lotion or powder in the perineal area. Third, next one, arrange for the patient to take a shower bath when permitted. The collecting container may be hung over the side of the tube. The catheter should be clamped temporarily if the collecting container is higher than the bladder. Teach the patient to maintain the catheter. Self-care helps the patient develop a feeling of independence and promote cleanliness. If the patient is ambulatory, instruct him in use of the leg bag. Encourage the patient to intake 2500 cc to 3000 ml of fluid daily. Change the indwelling catheter as necessary or to the accordance with local policy. When removing an indwelling catheter, we have to assess this type of equipment and assemble all supply and equipment. This type 10 cc of syringe, washcloth and towels, examination gloves, soap and water. Firstly, identify the patient and explain the procedure to him. Advise him that there will be a slight burning during removal of the catheter. Next, provide privacy and assist the female patient in a dorsal recumbent position. The male patient should be in a supine position. Wash your hand after removing the catheter. Put on the examination gloves. Empty the balloon by inserting the barrel of the syringe and withdrawing the amount of fluid used during inflation. Pinch off the gently pull on the catheter near the point where it exits from the meatus. Clean the perineum or penis with soap and water and dry the area well. Inspect the patient catheter to be sure no remnant remain in the catheter. If the catheter is not totally intact, report this temporarily and save the catheter for further inspection or any type of culture or examination. Empty the drainage bag, measure the amount of the urine and record to the intake and output sheet. Next, remove the catheter gloves and wash your hand. Next, discard disposable supply and return reusable supplies and equipment to the appropriate area. Record the catheter was removed, the time and date and by whom. Note the amount, color and clarity of the urine in the drainage bag. Also document all patient teaching done and patient F's level of the understanding. After removal of the catheter, assess the patient for 24-hour pattern of urinary elimination. Note the time, amount of the first voided urine. Report any of the following. Inability to void within 8 to 10 hours.